case counts and other relevant information with respect to COVID-19. In this briefing, we're going to be dealing with a couple of, three significant issues around the COVID-19 pandemic, and some of them involve changes. The first will be some briefing from Dr. Henry on COVID severity in individuals, which she promised on Monday, and answers to other questions that had been many reporters and members of the public have been asking. Secondly, Dr. Henry will be dealing with some update to orders with respect to worship services in BC. And thirdly, we'll be dealing with the issue of visitation and long-term care. And so that will make it a very busy session. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much. And as indicated, we thought we'd take the opportunity today to talk about a number of different issues and answer some questions that have arisen both from media and from the public over the last few weeks. So that's an opportunity for us to show some of the information that we've collected that is not always readily apparent in the way we present it on the BC CDC dashboard. So to start off with, I've been asked, and we've been concerned about the issue of young people and more young people being seen in hospitals and in ICU, and if that is a true increase in risk and severity, or whether that reflects what's going on in the community. So we've been looking at this in some detail, and this will be familiar to most people. As we know, in the last month and a half in particular, we've seen an increase in cases in people aged 19 to 39 in particular, and up to age 39 to 40 as well. So that is concerning. And that does reflect the fact that the good news is that we are seeing decreases in older age groups, particularly the over 80 age group, as we have protected more and more of our seniors and elders in long-term care. So because the numbers are increasing, the concern is, are we seeing more people hospitalized and more people proportionately in having more severe disease? And so this is a look at hospitalization by age and how we've progressed through the pandemic. And what you can see is that we have very low and stable rates of hospitalization for the younger age groups. So that's important to note. As we've seen over the last couple of months in particular, we have seen increases in COVID cases that are variants of concern. And in particular in BC, we've seen an increase in the B117 variant of concern. And that one we know is increased transmissibility, so it spreads more easily. And we've now seen data particularly from the UK, but some other countries as well, that shows that it can have increased severity of illness in younger people across the age spectrum, but that reflects also in younger people. So we are concerned about that. We've ramped up our capacity for screening, and as you know now, almost all of our cases every day are screened for mutations of interest that might be one of these variants of concern. There is still a day or so delay, which is one of the reasons we report it a little bit separately. So these international data suggests that the B117 could be more transmissible and could be associated with higher risk of more severe outcomes. What we have seen, though, here, that we've had just under 1,600 hospitalizations among people who are under age 60. Of those, 19% overall were people who required admission to ICU. When we look at the very small number of people who have been hospitalized with a variant of concern, and so far we have not seen an increased risk of hospitalization in that group, but the numbers are very small. We have, however, seen a slightly higher risk if you are hospitalized with a variant of concern, that about 30% of people required admission to ICU or critical care. So that's something that's a signal that we're watching. So far, the numbers are very small, so it's not something that we necessarily will is a is a worry, but it is something that we'll be watching and investigating further. The other thing that this does reflect, when younger people are in hospital, they thankfully have a higher proportion of people who survive, but it does mean that their stay in hospital is often longer, and we're seeing that reflected in the rates of hospitalization that we're seeing right now in the province. So that was one of the issues that has come up that I wanted to put a little bit of attention to today. The other couple of questions that we see very frequently, and I just want to say that I am very appreciative. People send me many, many questions, and we try to put answers sometimes through these media briefings, sometimes through the information, the Q's and A's that we put up on the BC CDC website in particular. One of the things that people have asked me many times is about, especially now, why are we seemingly easing restrictions when we are seeing a definite upward trend in cases? And that, especially in this past week, we've seen again a turn upwards. And really, it's not about easing restrictions as much as recognizing that at this phase in the pandemic, we need to focus on those things that we can do safely. So we know, and we've learned through the past year, that things that are done outside are much safer than inside. And that is what we need to focus on for the next little while to get us through this next few months as more and more people are protected. So the other thing that we have learned, of course, is that the vaccines that we have are very effective in protecting people, and particularly protecting seniors and elders who are most at risk. So that gives us some leeway to be able to have some activities, particularly outside activities, that are safer. And we've reflected that in the outside gatherings that we're allowing now, as well as in the outside services for faith leaders. I do want to remind people, though, that it is those inside activities that continue to be increasing risk. And I get asked all the time, where are people transmitting and why are the numbers going up? Part of that is because we are still actively following people and making sure that we're finding cases as much as we can, and people are getting tested, and the testing rate now is very efficient. The turnaround time is very low. But also it reflects the fact that we have ongoing transmission indoor settings. And there's a combination. We saw that there's an increase in younger people. So the combination that we're seeing is social events, small gatherings. We know that people need to get together, but we're seeing that people are taking that risk. And unfortunately, with the amount of virus that's spreading in the communities around the province, but particularly in the Lower Mainland, even a small group of people coming together means that you can transmit. So those are the things we need to pay attention to coming through this next few months. The other area where about a third to 40% of our cases are rising are in work sites. And these are work sites across the board. Some of them are small settings, like a small restaurant or a gym. We've seen many different settings where where transmission can happen to one or two people, but then that person will go to their work site. We've also seen large transmission events and outbreaks in many of the essential workplaces that we have around the province. And so we have taken some measures, as you know. We're addressing some of the outbreaks with making sure we have the tool of immunization to help us with addressing particularly the larger outbreaks in some of the more essential workplaces, and those workplaces where the COVID safety plans are really difficult to adhere to over time. The other measure that we're taking is we've been working with our workplace task group to put in place protocols for investigation of clusters when there's been transmission in a workplace, and we're going to be stepping up the monitoring and the enforcement of those, including making sure where there is transmission in a workplace, that workplace is shut down for a period of time during which people are isolating, so they're not continuing to come into that workplace as much as possible. So that's something we'll be paying more attention to with our environmental health officers working with WorkSafe PC in the coming weeks. We've also had a lot of questions about variants of concern, and I've mentioned some of them as well. But the bottom line with the variants is they are replacing and taking over the other virus strains that we have seen over the last little while. But we do know that the measures that we take to prevent transmission are the same ones that work for these variants, and we've seen that internationally. It is, of course, a concern where some of the variants that we've seen have issues around increased severity of illness or lead to concerns about whether vaccines are as effective. That is why we need to pay more attention. There's little room for margin for error right now, and that's why we continue to have the focus on restriction of indoor activities. Finally, I know there's been a lot of questions in the last week about things like clinically extremely vulnerable people and the letters that people will be getting in the mail. That list is a very specific list based on risk that is over and above the age base that people are in. So these letters, we focused on people between the ages of 16 and 65 and 69, and that is because everybody else is in the age-based program already, and within the next week will all be eligible for vaccine. So it is people who are moving up the queue because of a health condition that they have. So it's supplemental to the age-based program that we have, and it's based on risk. And there was a very rigorous process that we went through with specialists in cancer care, in genetics, in developmental issues, led by the Provincial Health Services Authority, that identified the categories that we are talking about and the people that received letters or will receive letters in the next few weeks. So those categories are very well defined, and they're that way on purpose. These are specific conditions, and I know many people have been calling my office, many people have been calling others because they are concerned that they are on this list or are not on this list. And I just want to say we all need to be patient. There will be vaccine for everybody. And as we move down through the age groups, people will become eligible. And the good news is that is rapidly speeding up in the last few weeks. But there is a process for this clinically extremely vulnerable people that is based on evidence and based on risk. And we'll be adhering to that process. The other question that I've received a lot of course, in the last few days has been around who's eligible for the parallel process of AstraZeneca and the Covishield vaccines that we have, the fridge-stable vaccines. And again, we had a limited amount that we received about 2 weeks ago, and we are focusing on where we can put out outbreaks and address some of the high-risk areas in our communities. And we know, particularly in the Lower Mainland, we've been looking at that, looking at congregate living settings for farm workers. But these are all directed by public health, where we recognize the risk, where we have seen risk in specific communities, industries, and businesses. And you will be contacted directly by public health if you are part of that program right now. As for the part 2 of that, if and when we receive more of the AstraZeneca vaccine or other vaccines, and right now we don't have a timeline on that. We're still getting information from the National Operations Center on when we might receive more vaccine, but it will be in the coming weeks. And we have defined those groups for some people, and we are working on the working out of the other higher groups that were presented last week. I know there are many, many people who feel they should be in that group of people, but let me just say there's a limited amount of vaccine, and we have based this on a number of different principles, including risk, including societal disruption, and the ethical framework that we have. And it does not in any way reflect the value or the essential work that so many people have been doing across British Columbia since this pandemic started. It reflects merely the amount of vaccine that we have and where we can best target its use to try and minimize societal disruption and to protect and to prevent transmission in our communities. And as we have more vaccine, we'll be expanding that program. But I will remind everybody that we also are moving ahead very quickly with our age-based program, and very soon, within the next few months, those will converge and everybody will have vaccine available. One of the other things that we've been working on over the last number of months has been working with faith leaders across the province, and we've come up with a variance to the gathering and events order that applies to outdoor religious services and faith services. And we've also developed a variance in close collaboration with the faith leaders across the province through a dialogue process led by SFU's Morris J. Wask Centre for Dialogue and Dr. Robert Dome. And we now will have a variance as well for indoor religious services for a very specific frame or set time coming up in the next few weeks, where we know there are a number of important religious holidays. And I'm very, very grateful for the expertise and input that I've got from leaders from a very diverse spectrum of spiritual and faith communities. This represents a first step in the gradual reopening of indoor faith and spiritual group gatherings in British Columbia. It builds on our recent outdoor variance, which permits outdoor religious services for up to people with specific conditions. And we are hopeful that this one-time indoor variance can be extended as soon or after the end of the trial period that we have in May 13th. But of course, it's based on the pandemic and the epidemiologic situation that we're seeing here in BC. So time will tell. The time frame that we have for this variance is March 28th to May 13th for indoor, and that was selected with careful consideration of the very important upcoming holidays across different distinct faith communities in the province. It comes against the backdrop, as we've just talked about, of increasing case counts. And if conditions require us to revisit this, we will do so in consultation again. And I am very appreciative that faith leaders have expressed that we all have that common goal of keeping people safe through this very, very challenging year. We take no pleasure, of course, in limiting any of the religious community's practices, and we want this to be a success. We want to make sure that we are protecting those most vulnerable amongst us. So we ask as well that people who take place in these both outdoor and indoor gatherings cooperate with their leaders, understand that this is a way of us trying to meet our needs for connection and community, to comply with the public health need that we have to try as much as possible prevent transmission as well. But I have respect and faith and trust in our faith communities that we will continue to work together to make sure that we can do this safely in the coming months. Okay, and finally, I'm going to talk a little bit about another very important change that we're making, and this is in our visitor restrictions in long-term care and the seniors assisted living. As you know, there have been no group more adversely affected in our province than our seniors and elders and people who work in long-term care and assisted living. And I am very, very pleased that we are at a place where we can make some changes that will affect people's quality of life. As you know, since last March, we've had restrictions on visitations. We changed those and modified them in June of last year and have updated the guidance as we've gone along. But really, the most prominent priority that we have is to protect those most vulnerable to severe illness. And we know how this virus can be so pernicious and spread so quickly in these facilities. With this added layer of protection, however, that we've got from immunizing the most vulnerable amongst us, it means that we can support safe social connections again. So as of April 1st, to give facilities some time, we've consulted with many of them across the province and to make sure that we can get these in time for some of the important holidays as well. As of April 1st, all residents will have regular, frequent, and routine opportunities for social visitation in long-term care and assisted living. We know that visits must allow for a minimum of an hour. For some residents, that may be too long. They may not be up to having visitors for that long, but that's a minimum that we need to be able to have for each visitor. Requirements for the single designated social visitor are removed, and now you can have additional friends and family. However, we will be limiting the number of people at any one time. So to 2 visitors plus a child, to allow for visits to grandparents and great-grandparents as well. The location of visits are now changed so that your family and loved ones and friends can visit in a residence room primarily, and we'll have provisions for residents who are in multi-bed rooms. And of course, the all-important physical touch. So we are now at a place where we know most of our residents are protected, and we can allow for that important connection between family and friends and visitors, but bearing in mind that we still need to have infection prevention and control measures in place, and that will mean wearing masks for the time being, because we know that there is still a possibility of transmission and that not all visitors will be immunized at this point. There will be other restrictions, like only visiting your one friend or loved one and not visiting multiple people. And I think that's a really important one. And making sure that visitors aren't participating in group activities where their risk can spread to others. But we also know that removing some of the social and emotional connections within a facility is very important. So we'll be removing the physical distance requirements between residents so that we can have things like communal dining, small group social or recreational activities for residents. But it will be within a limited place, so not the entire facility if it's a large facility, making sure that we're not taking too many risks. As well, residents will be supported to go on outings with no requirements for isolation when they come back, including outings with family and friends, and removing the requirement for a 14-day isolation when somebody is admitted to the facility, and making sure that we're stepping up the immunizations of people who are awaiting placement in long-term care. As we know, outbreaks have decreased in long-term care and assisted living, and as a matter of fact, we have only 3 now. But the rate of transmission in our community remains very high, and in some cases is increasing. So we need to make sure we have safety precautions in place. That means minimizing interaction between residents and visitors, making sure that we have adherence to infection prevention and control, screening out of people who are ill, monitoring, signing in, so that people aren't putting people at unnecessary risk. The reality is that it is likely we are going to have more outbreaks in care homes now that we're allowing more people to come into those care homes. But we are at a point where the benefits of having those social connections and interactions outweigh the risks, and we know that we can manage those risks with the vast majority of residents and staff now being protected with immunization. So So as I said, social visitation will still have some restrictions in place around advance booking and screening, etc. So these changes are effective starting in April 1st, and we'll be looking at them and revising them as needed over the next few months. And we're committing to looking at how we can expand them by at least June 30th, depending on how things go with our pandemic. So we will be posting the updated visitor and infection prevention and control guidance very soon, and continuing to monitor so that we can support staff and residents and families and communities to make sure that we're doing this in a safe way, and we will review and evaluate the restrictions as we move forward. I think this is an incredibly positive step that many families and care homes have been waiting for some time. We are in a very challenging place, as we know, with the pandemic across the province. In some communities, rates are increasing quite dramatically. So we will need to take this slowly, but it is an important step forward to being close again and supporting our seniors and elders who have suffered so much in this pandemic. So I'm going to leave it at that. Lots of bits and pieces today, and turn it over to Minister Dubs.
Thank you very much, Dr. Henry. And I think it's also, with respect to long-term care, a really good day. You'll see soon posted on the BC CDC and Ministry of Health websites this document, which is an overview document of visitors in long-term care and seniors assisted living for people who I know will be very interested in all of the details of the announcement, to find it there. It was St. Patrick's Day last year when public health emergency was declared in BC, and on that day as well, Dr. Henry and her team informed long-term care homes in BC that visits would be limited to essential visitors. And I think it's fair to say, and I know this because of the many family members of people in long-term care, including my own family, that many of their friends, many residents of long-term care who've contacted us and spoken to and corresponded with, that it has been not just a long, cold, lonely winter, but it was a long fall and a lonely fall and a lonely summer. These measures, I think, everyone understands were necessary, and they were part of a series of measures involving PPE and adding staff and single site. Today I can report that in our plan over the next 3 years to add 7,000 workers in long-term care, 2,500 have already been added. With extraordinary measures by health authorities on more than 100 occasions to send in teams to facilities with public beds and private and not-for-profit and for-profit facilities to support staff there, and the long list of measures in support of long-term care and efforts in support of long-term care that, of course, include, most importantly, the extraordinary commitment of staff and of families and of the residents themselves in trying to make the best of what has been an extraordinary and difficult situation. So I am, like I think everyone in BC who knows someone in long-term care, moved at the idea that people will be able to visit again who weren't able to visit, touch each other again who weren't able to touch each other. It will make an extraordinary difference. And our commitment, I think, that goes beyond the government to society as well, is to continue to make not just life, to improve the safety in long-term care and to ensure that people live longer in long-term care, which is happening, but that we live better. That should be our commitment to one another, because even if our family members are not currently in long-term care, or we are not in long-term care, that day almost certainly will come for every family in BC. I want to also acknowledge the efforts to vaccinate in long-term care. As you'll know, more than 30,000 residents, close to 40,000 staff people, more than 8,000 essential visitors in assisted living, similar numbers have been immunized in the time. We had 42 long-term care outbreaks, 49 long-term care assisted living and independent living outbreaks on January 15th. And we now have 3, 2 in long-term care and 1 in assisted living. That tells us what immunization can do for all of us. But that moment for all of us is, of course, not here yet. I wanted to make a couple of points about immunization because, like Dr. Henry, we get questions. I even got questions in the legislature today. 610,671 doses have been delivered into people's arms in BC. 520,459 of those were first doses, 87,212 were second doses, 28,037 doses today, a new record, and we will be setting records day unto day unto day. I also want to note that we've received this week about 161,000 doses of Pfizer vaccine. So some of that was Monday, some of that was Tuesday, some of that was Wednesday, and then distributed to health authorities. Much of that, a significant portion, not all of it, but a portion of it has already been used. I would note that of Pfizer vaccine, 462,573 doses, and at the rate we're going through, it will have the same situation this Sunday as last Sunday, which will have used up virtually all of the Pfizer vaccine that we'll have received, and be looking forward to our new shipment. With respect to Moderna, we are expecting more doses tomorrow, and then through the weekend and into next week. That delivery has been less consistent, but at present we have only about 10,000 doses of Moderna. This was as of yesterday on hand. And people have asked about AstraZeneca and doses that may expire. Doses that may expire of AstraZeneca on April 4th. Those doses will all be used. Already, more than 22,000 doses have been used, and we're well on our way, as all of you know. In short, the immunization campaign that's been led by our whole team, the team in public health, the team led by Dr. Penny Ballum, the team led by Deputy Minister Steve Brown, has been nothing short of exceptional. When vaccine comes, it's delivered as it should be, and it's being delivered to those who are most vulnerable, and we see the impact of that in long-term care, and I am proud of everybody involved. I want to say, finally, just a couple of more administrative notes. As you know, at noon today, people 75 and above, born in 1946 or earlier, were invited to call Regional Health Authority call centers. We've been receiving large numbers of calls, and the turnaround, I think, in general has been very good. On Friday, March 26th, that will be people 74 and above, born 1947 or earlier. As Dr. Henry noted, those who are clinically extremely vulnerable will receive an invitation letter to book. We'll start booking on Monday, March the 29th at noon. And with respect to, and I will spare people a little bit, an extensive discussion of surgeries, just to note that the week of March 8th to 14th, the number of surgeries completed in BC was 7,557. Which is 552 more than the same week last year. We're not going to be making that comparison anymore. As you know, we're a year past when we interrupted surgeries, so that number in future weeks will obviously be a large difference, but that's related to the decision to put a halt to non-urgent scheduled surgeries. So in closing, 4.3 million people in BC eligible to be vaccinated. 523,459 have received their first dose. That's 12.1%, 7% of British Columbians vaccinated with their first dose. And with that in context, we had hoped that that number would be 10% by the end of March, and so we are ahead of schedule of what we had expected, but obviously 12.17% is not close to community immunity. We've shown, I think, what a restorative difference some days could make. Today, the changes in visitation. Last week, the surgical renewal commitment progress, which showed that our wait list for urgent surgeries had dropped by 12% compared to last February, an extraordinary achievement by healthcare workers. We've shown, and we're going to show, I think, working together, that it's possible to have religious gatherings outside. Dr. Henry talked to that on Tuesday. and that we're going to show, I think, during these important religious holidays coming up, that some coming together is possible. But let's, be clear. The level of transmission in BC is way, way too high. And we have to collectively do something about that. Not for a long time longer. We're a year since the beginning of just over a year more than the beginning of the pandemic. But right now, we all need to take steps. Sometimes people say, talk about measures. We have powerful measures in place with respect in every business. We have measures in place, and we have powerful measures in place with respect to social gatherings. Essentially, you can gather indoors only with people in your household. And that has to continue for the moment. The numbers tell us, the numbers yesterday tell us, the numbers today will tell us, the numbers tomorrow will tell us that that is essential for everybody. That at the end of this pandemic, this awful, awful virus, which can affect all of us, should not affect so many of us at the end of this pandemic, putting so many of us at risk. I ask everybody, given the good news, which is the result of the good work of people in BC, resuming visitation, protections for long-term care, the opportunity to do some more things together, the opportunity to go outside more, that the orders that are in place be followed right now. It is going to be April next week, and we are moving forward. We're moving forward to 1 in 8 people now immunized in BC who can be immunized in our province. But we've got a ways to go, and we really need to dig it in. We can see the light, but the fact of that light means in the present we need to hold on a little while longer, and I encourage everybody to do that this weekend and in the week leading in to the Easter long weekend. À partir du 1er avril, les restrictions en matière de visites sociales dans des établissements de soins de longue durée et d'aide à la vie autonome seront assouplies. Il n'y aura plus l'exigence d'un visiteur désigné unique, ce qui permettra aux amis et aux autres membres de la famille de visiter les résidents. Un maximum de 2 visiteurs et un enfant pour en faire ces visites. Cela permettra aux visites d'avoir lieu dans les chambres des résidents sans la présence du personnel. Les contacts physiques seront aussi permis lors des visites tant que les mesures appropriées de prévention des infections et de contrôle telles que l'hygiène des mains sont en place. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up only. First question today is from Lisa Houston, News 1130.
Hi there. I'm wondering about, there's a study done in UBC, and I'm guessing this is for Dr. Henry, and also some in, I've seen some out of the UK, where there's some question about the efficacy of one shot or how fast it wanes for people who are clinically vulnerable or older or who have cancer. And I'm just wondering how much that is weighing in or weighing as a concern of this 4-month span that we have planned here going forward.
Sure, yeah, and that's something obviously that we're watching carefully. The study from UBC looked at a very small number of people and looked at in long-term care, so both healthcare workers and residents, and it looked at antibody levels. And they found that the antibody levels were lower in long-term care residents in that small number. I believe it was about 18 people. So one of the things that we don't know yet is what we call a correlate of protection. So how much antibody reflects how protected you are. So there's other ways we look at that as well. And there have been other studies, one from the UK in a much larger group of people, that showed that antibody levels in older people actually were quite high for a longer period of time, which is all to say we're learning as we go. And one of the things that is really important that we're doing here in BC and other places around the world are doing as well is what we call vaccine effectiveness. And Dr. Skowronski and her team at the BC CDC have been doing this. And what it is we link people who've been immunized with cases, and we see how protective the virus, the vaccine is over time. And that is some of the data that allowed us to extend that interval and to recognize that we were getting good protection that was lasting for many weeks. So we will be continuing to do that, and we'll be continuing to watch. And if we start to see a decrease in protection, in real-world protection, in vaccine effectiveness in elderly people, then we will speed up second doses for that group of people. Right now, the people who most likely have a second dose are people in long-term care, but it's not everybody. And we know that the age-based program as well, we're watching that very carefully. So we will continue to watch, and if we see a decrease in protection over time, we'll be looking at changing that. Same thing goes for certain populations, and really it is, again, another very small study that showed that people with certain types of blood cancers may not mount as an effective an immune response after a single dose and may need a second dose sooner rather than later. And again, the implications of that in the grand scheme of things are things that we don't yet know because it was based on antibodies. So we will be watching that again very carefully as well. And we've been reaching out and connecting with our cancer care colleagues in those very specific cancers that we're talking about, and we'll be monitoring people in that population to make sure that if that turns out to be the place, then we will adjust the time interval for those specific populations. So I think there's, the one thing we are learning is that we are learning more information about exactly who responds best, how long it lasts, and for most of us, it's going to be probably 4 months, depending on when our vaccine supply comes. But I also think we need to look at the data that we have from other vaccine programs and what we're seeing around the world. And it may turn out to be that a booster dose is most effective if it's given even later, so maybe 5 or 6 months for most people. And that may give us longer lasting protection that will take us through next year's respiratory season, now that we believe that coronavirus is going to be with us for a while. So those are things that we will learn and that will change and adapt as the program goes along over the next number of weeks and months.
Lisa, do you have a follow-up?
I do, and it's about the variants. You're mentioning how many questions you get. I'm sure I can imagine the mountain because I get some. But about the variants, P1 is one that seems to be catching a lot of people's attention because it's more than doubled in less than a week and did the same last week. And so I'm wondering if you could talk a bit about the concern of that. And if you can give again, last time you gave it, I think it was 10% of cases was the positivity rate of variants of the number you were testing, or the number, now I'm going to get it wrong, the number that you're testing and the positivity rate of all, the percentage of all the variant cases that we have in BC were variants. Oh my God, I'm sorry, my words are so terrible right now. But I'm wondering if you can give us a bit of a look at what the percentage is overall and you're concerned about this P1 and if that affects kids going back to school, especially in Surrey next week.
Yeah, I can answer the last one. The variants are just a new strain of the virus that have slightly different characteristics, and we're realizing that. The variant that we are seeing most commonly is the B117. We've seen it spread in the Lower Mainland in particular, and widespread. So we are, of course, doing case management and contact tracing aggressively around all cases, including the variant cases, and it's not going to affect return to school next week. The P1 is one that we are watching closely. As you know, we had seen a bit of a surge in the 351, the one associated with South Africa, but that seems to have settled down. The P1 we've been seeing primarily in Vancouver Coastal, but we've also had a couple of clusters in Fraser Health and in the interior. And so, yes, we are watching those very carefully. Most of those are no longer active cases. There was a large cluster in Vancouver Coastal that was contained once it was found. There's been 2 two clusters in the interior health region, and again, both of those have been contained, but we are seeing increased growth. And again, that's something that we're watching really carefully. It is concerning because this is a variant that we've seen be very destructive in Brazil, and there's concerns about the effectiveness of vaccines. So my public health colleagues on the front lines are being very actively following people. What I can tell you is the majority of cases, even though the numbers are going up, they're clustered together, and they're groups of people who have been transmitting within that group, but we've been able to prevent the next generation of transmission. But it is harder the greater the number of cases there are. Overall, we are now screening with a test that looks for one of the mutations specifically. We're screening, it's close to 100% of all of the positives. It takes an extra day or two for the screening test to come back, and then those are screened positives are going for whole genome sequencing. So there can be a delay of several days before we know what variant it is, and that's one of the challenges that we're working on. But we are now seeing a steady increase in overall percentage, and it's in the vicinity of the high teens and early 20s as of what I was looking at today. So we're in the high teens right now in the overall percentage of our cases that are variant cases.
Next question is from Penny Dufflo, CTV. Penny, are you there?
Hi, can you hear me now?
Yep.
Okay, sorry about that. Just going back to the UBC study, the authors specifically pointed to care home outbreaks we've seen in recent weeks as part of their conclusion that, quote, we recommend the second doses not be delayed in elderly individuals. So given the research and the fact that you said you do expect more outbreaks as visitations increase, why not revise the policy for the very elderly so that they don't have to wait 4 months for the booster just in case the study is in fact pointing to a really big issue that needs to be addressed?
Yeah, so I think I would look at the outbreaks that we've seen in the last really one since people have been immunized as an example of how we are seeing very good protection in long-term care. And that is, the Cottonwoods outbreak, where there were a number of recently immunized people, as well as people, a very small number who had received 2 doses, but within a short period of time. And we had very mild illness, and thankfully nobody has died in that outbreak. So this is what we're likely to see, and we have other measures that we can take as well that need to supplement it. So, looking at a very small number, 18 people, and looking at antibodies in 18 people doesn't change our management when we have other studies that have shown us that there is still a very high level of protection overall. And we do need to focus our attention on getting as many people that higher level of protection from a single dose right now. And that is our focus, but we'll be watching very carefully.
Penny, do you have a follow-up?
I do, for a colleague. Given that families are still fighting for essential caregiver status and in some cases have only been granted a half-hour social visit once a month, how are you going to ensure that care homes do start allowing families in and follow the new guidelines you've laid out today?
Yeah, that's a really important question, and one of the biggest concerns that I hear about, and I know many others hear about, is inconsistency in how the last guidelines were applied, and it is absolutely a challenge. We've been consulting with care homes, with the care providers associations and others to make sure that they are well aware of the expectations, and we're presenting it to you today and to the public today so you are aware of these expectations. And it is time. It is time for us to safely move to having that important connection with our loved ones in long-term care, and we will do that together. There is still in place that process to be able to go to the Patient Safety Quality Office, the Ombudsperson's office, and of course my office if there are concerns, but we expect this to be phased in and to be by April 1st trust that people will have increased visitation and contact and connection.
Next question is from Prabjot Kalan, Omni TV.
Hi, thank you so much for taking my question. Dr. Henry, actually some seniors reached me, and especially 3 seniors who booked the online for the vaccination from the Fraser Health. One is 78-year-old and 2 is 74-year-old. They all live in the same place. They booked the same time and they got the confirmation. So when they went to the site and only 78-year-old get the vaccination, 2 were returned because you are not qualified. First of all, on the website online booking, there is no age verification checking system. So they're very upset why they get the confirmation if they're not getting vaccinated. Secondly, they have the concern if the seniors who has only 2-3 year age difference and living at the same place, why not getting the vaccination same time?
Yeah, you know, this is a challenge. We are trusting people to follow the guidance that we have, and we know that people will be coming up very soon, and we're able to move that up as much as possible. The online systems are different in how they do that. Very soon, we'll be going to a provincial online system that will be a little bit more standardized, but it is challenging to make different algorithms for different parts of the province. And there are some communities where that was available for people. But we're telling people that that is the reason why we are asking you to do it in your age groups. For every clinic, we have the set amount of vaccine that's available for people who have those appointments. And we have to make sure that we're doing it in an effective way. And, you know, it's just, there are lots of small differences that some people get it ahead when they're not supposed to. Other people have been able to go in for appointments because there have been appointments available. I think the important thing is we're getting people immunized as best we can over the next little while. There'll always be little bits of hiccups, but I encourage those people to please go back, get your immunization. We know it'll be there for you and it'll protect you.
Prabjot, do you have a follow-up?
Yes, please. And there is a lot of seniors who don't speak English and don't understand at all. Even they can't book online or even on the phone. And they're living by themselves. They're not getting help from the family members. They always rely on to the different community members or sometimes temple for to these medical helps, etc. So they're asking, we need more booking center at the community level, at the neighborhood, especially basic, like language-based centers. So you have any suggestion for them?
We absolutely, we hear you, and we're working on some of those as well. You know, I encourage groups in the community to reach out to your neighbors. We know there's a lot of that going on. We're trying to make sure the clinics as well have people who help make you comfortable and speak in multiple different languages and help people flow through. And I know there are many groups in the community are reaching out to help their seniors, and I would encourage people to continue that.
And I just wanted to, I think the Premier talked about the contribution of many businesses in our Team BC approach to vaccination yesterday, but it's actually going on in the community. So I encourage us to support one another in these times. In the 90-plus category, a very substantial majority of people have now been immunized. In the 85 to 89 category, that's the same. And we are looking, and I know that both Vancouver Coastal Health and Fraser Health, both health authorities with many diverse languages, are looking to reach out to make sure that people aren't being left behind in that process. And so that effort is being done particularly in the South Asian and Chinese Canadian communities, but other communities as well. There's also a facility in our phoning system for multiple languages, so I ask people to reach to that. And I also ask us to support one another. If you know a senior who might need your support, provide that support. I think what we've seen with the success so far of the immunization by age cohort and the high level of response in all of the health authorities, especially in all of the 80+ categories. I think the number today will be close to 140,000 people in those categories alone have been immunized. I think that shows that it's working. We can always do better, and our health authorities who have the most significant populations of people who speak languages other than English are taking a proactive role in making that happen as well.
Richard Zussman, Global News.
Dr. Henry, I'm just wondering if any consideration was given to requiring visitors to assisted living and long-term care to be vaccinated, and why was that ruled out as a possible barrier of protection for visitors coming into care homes?
Yeah, so as you know, the visitor policy is changing, so there can be multiple visitors and many people, and we know that for many residents, that's going to be a wonderful thing. We also know that the vaccine itself protects people very well, even seniors and elders in long-term care. So with the other measures that we have in place right now, including screening people out with health screening, getting tested if they need to, making sure we're still using things like wearing masks, going only to visit with your one friend or loved one. Those are things that will help protect everybody, and it just is not feasible to have every visitor immunized ahead of those who are most at risk right now, which is based on age and underlying medical condition. So many people will be eligible, and we know that many visitors are already in those ages that are eligible to be vaccinated, but the focus of the program continues to be on that age-based risk profile.
Richard, do you have a follow-up?
I was just wondering if you could provide some additional details around the church gathering provision you mentioned earlier on in the briefing for the indoor gathering, some details on what that will look like. And I know people often link these two. Is there any update on when movie theaters may be able to open up under some certain provisions?
Yeah, so there's those are quite different things. And when we're talking about faith and religious-based services, we know that there are special considerations that need to be taken under our Charter of Rights and Freedoms. So I think that is a very important measure that we take very seriously. So religious and faith gatherings are under a different category. And yes, what we've done through this dialogue is the order will, it's a variance, what we call a class variance for all religious services that will allow indoor services on 4 days between Sunday, March 29th and Thursday, May 13th. So that's the period of time that I mentioned that covers many of the important holidays for a number of different faith groups, whether it's Passover, Easter, Ramadan, Vaisakhi. So each faith will identify the days that are most appropriate for their faith, and that whatever it is, and the maximum capacity will be 50 people or 10% of the allowable space or the space available, whichever's less. And so we'll be going back to very similar conditions to what we had last October, November. And when we had discussions with faith leaders, we all recognized that this was a step forward, that this virus doesn't recognize where we are in an indoor setting, but that we needed to try and take steps together to allow for some of these important services to be celebrated. So that's how we're going to do it for now. And we're going to use the experience of how things worked, what things worked for different groups in different settings, and use that to come together again through dialogue and develop our plans for the future to going back to full in-person faith services. So it is a trial period, if you will, recognizing that we have this commitment to faith and religious services that is very special and important.
We have time for one more question today. For everybody listening, Minister Dix and Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Our last question today comes from Tanya Fletcher, CBC.
Dr. Henry, what steps are being taken in long-term care homes to make sure visitors aren't mixing with each other in lobbies or common areas? It seems as though they'll be the ones who largely aren't vaccinated, and since there's more transmission currently among those younger age groups, is there concern they'll be unknowingly spreading the virus between each other?
Yeah, that is a concern. The more people that we have in those congregate living environments, we know risk goes up. But as more people are protected through immunization, so that's why we have other things in place as well. So you will continue to have to book ahead to make sure that you sign in, that you're screened, that you only go to your one person, that you're not participating, that visitors aren't in group settings within the facility, etc. So there will be measures in place to ensure that there's a steady flow of visitors rather than everybody coming at once, and that people are screened appropriately as well.
Tanya, do you have a follow-up?
Yes, please, and if we could get an answer in French from Minister Dix as well. A follow-up to Richard's last question there about details on the temporary indoor religious services. How long will the services be allowed to last for, and what is the measuring stick that would allow them to continue beyond a one-time variant? What would be a success and what would mark the failure?
Yeah, so we've allowed, so there can be, different services require different periods of time, so we've not put a time limit in, but there's a time between if people want to have an Easter service on Easter Sunday, for example, they can have more than one group, but there needs to be a time in between so that there's not mixing of people, etc. So we'll be looking at how things work. There'll be a couple of things that will measure success, and part of it will be ensuring that there's no transmission, which we had seen and actually continue to see in some venues, but also that the faith leaders are able to effectively have the services that they want, that they're comfortable, that people are protecting each other appropriately and being able to do it appropriately. So we'll be monitoring all kinds of things. I think there's the things that I've learned in the dialogues we have been very helpful in understanding the unique needs of different communities and services. So we'll be looking at which are the things that worked and which things we need to modify going forward. But my hope is, and to the last week notwithstanding, that as we protect more and more people, we'll be able to safely come together in ways in person, inside. But right now, between now and the end of April, early May, is going to be a very difficult time for us, and we need to really focus on those things that we can do safely. So that means if you're used to having a Easter supper at home and having your family together, this is not the year to do that. This is not the year to have Passover suppers. This is not the year to have Ramadan with your family coming together, or large groups of people coming together in your home. We need to continue to keep each other safe as we go through these next few weeks, as more and more people are protected.
Il y a bien sûr la réduction en général de transmission dans la communauté qui est nécessaire pour tout ce qu'on veut faire dans les mois à suivre. Donc ça, c'est important. Le Dr Henry a dit très clairement qu'il ne faut pas avoir des soirées liées aux événements religieux chez vous après les services. Ça, c'est essentiel. Maintenant, surtout cette année. Et on sait que c'est une limitation importante pour beaucoup de monde, mais il faut suivre les règlements maintenant. C'est plus important que jamais. Cela étant, je pense évidemment le bon déroulement des services est important. Des entr'actes entre des services religieux, s'il y en a plus qu'un dans une église, une mosquée ou que quelques venues que ce soit. Et donc, je pense que ces choses-là sont importantes et que la réussite, en fait, de ces services dans leur but de célébrer et de reconnaître des événements importants religieux dans la province. Donc, ce sont des éléments d'une réussite. Mais la chose la plus importante, c'est de réduire la transmission actuellement. Et cela va ouvrir les portes à beaucoup d'activités dans la société, y compris des activités religieuses. Merci beaucoup. Thank you very much. We'll see you next week.